Imagine just for a second that you are at a crowded grocery store, or maybe you're out for a run, and you suddenly feel this massive sneeze coming on.
Oh, yeah, the absolute dread of that moment.
Right, because for a lot of people, that triggers instant panic about leaking. But what if you knew with absolute 100% certainty that you wouldn't leak a single drop?
And crucially, that you achieve that without having done, like, a single Kegel exercise in months.
Exactly. Because today we are looking at a physical system where our traditional understanding of brute muscle strength just completely fails us.
It really does challenge everything we think we know about fitness.
Oh, yeah.
I mean, we are so conditioned to believe that if a physical system in the body fails, it just needs to be bulked up, right?
Yeah, totally.
We constantly equate capability with muscle mass. But what we're looking at today is, honestly, the absolute definition of a timing issue that is just disguised as a strength issue.
Yes, exactly. And honestly, that is a concept we're going to keep coming back to today because it completely reframes how we understand our own bodies. So we are so glad you are joining us for today's deep dive.
We really are. We've got some amazing material today.
Yeah, we are sorting through this really fascinating stack of sources. We're talking clinical trial protocols, physical therapy guides, urology papers, and this brilliant randomized controlled trial on video tutorials.
Which is such a cool study, by the way.
It is. Our primary mission here is to decode this highly effective yet surprisingly simple technique called the Knack maneuver. We're going to figure out what it is and exactly how it is timed to prevent stress, urinary incontinence during sudden coughs or sneezes.
And it's such a profound shift in how we view body mechanics. I mean,
Hmm.
we're moving away from the exhausting idea of just endlessly building muscle and moving toward precision, coordination, and, well, simply using what you already have more intelligently.
Okay, let's unpack this. Because before we can understand how this Knack maneuver actually prevents leaks, we first have to understand the mechanical failure that causes them in the first place. You can't fix a leak until you know why the pipe is bursting when you cough, right?
Exactly. And, well, to understand that bursting pipe, we need to introduce the anatomical concept of the abdominal canister.
Okay, the abdominal canister.
Yeah, so if you are listening, imagine your abdominal cavity as like a sealed, pressurized cylinder. The roof of this canister is your diaphragm, which is your main breathing muscle right under your ribs.
Okay, I'm picturing it.
Then the sides are formed by your abdominal walls, your back muscles, and your bony structures like your spine and pelvis. And finally, the floor of this canister is made up of your pelvic floor muscles.
So it's essentially a completely closed system, meaning whatever happens to the pressure inside that cylinder affects every single wall of it. Yeah.
Exactly right. Now, think about what happens when you perform any kind of strenuous activity. So if you jump, if you laugh forcefully, lift a heavy box, or, especially if you cough or sneeze, your diaphragm violently pushes down.
Oh, wow.
Yeah, and this causes a massive, instantaneous spike in the intra-abdominal pressure inside that canister. That pressure pushes out against your stomach walls. But crucially, it also pushes straight down onto the bladder and the pelvic floor.
I mean, it's basically like squeezing a water balloon from the very top. If the bottom of that balloon isn't supported, the water has to go somewhere.
Yep, the path of least resistance.
Right, the pressure is going to force the fluid out. But, that brings up a really obvious pushback question. Doesn't every human being experience that exact same pressure spike when they sneeze? Why does it only cause a leak in some people and not others?
Well, that is the crux of the entire issue. In a healthy continence system, there is an automatic involuntary reflex that happens entirely behind the scenes. Between 210 and 270 milliseconds before that intra-abdominal pressure actually hits the floor of the canister,
Yeah.
your pelvic floor muscles automatically contract.
Wait, really? So the body actually anticipates the sneeze and locks the door before the pressure even arrives?
Precisely. It is this brilliant feed-forward cycle. So by firing early, this reflex keeps the urethral closure pressure, which just means how tightly the exit pipe is squeezed, shut higher than the pressure building inside the bladder above it.
Oh, I see.
Yeah, so by the time the downward force of the cough actually reaches the bottom of the canister, the exit is already securely locked and braced.
But for people dealing with stress urinary incontinence, that automatic lock is basically malfunctioning.
Yes. In women with stress urinary incontinence, which, by the way, affects up to 60% of women at some point, and it tends to worsen with age, hormonal changes, or after childbirth, that automatic reflex is disrupted.
Right.
The signal basically gets scrambled. So it might be too weak, it might be delayed by just a few crucial milliseconds, or it might be lost entirely.
And the sources mention that this can happen because of nerve or fascial damage, right? Meaning the
Yeah.
actual connective tissue that holds everything in place gets stretched out or the nerves get compressed. It's almost like a frayed wire that just isn't sending the electrical signal fast enough anymore.
That is a great way to visualize it. The wire is frayed. So the sudden pressure hits, the urethra isn't braced in time because the signal was late, and unfortunately, you get a leak. Which raises an important question. If that automatic reflex is lost or delayed, how can we manually override the body's system to prevent the leak?
Right, because since the root problem is a sudden localized pressure spike overcoming a delayed reflex, the solution isn't just having passive muscle strength.
Exactly.
I mean, if the muscle is super strong but asleep at the wheel, you still leak. The solution has to be a targeted, conscious countermeasure, which, brings us to the Knack maneuver.
Yes, the knack. The term was actually coined back in 1998 by Dr. Janice Miller, who is a prominent researcher in this field. It involves a voluntary, conscious contraction of the pelvic floor muscles to preemptively brace for a known leakage-provoking event. Depending on what piece of medical literature you read, you might also see it called the perineal lock, the pelvic clutch, or just simply squeeze when you sneeze.
Squeeze when you sneeze is definitely the most catchy, I have to say. But I actually love the word knack. It implies an adroit trick, right? Like a motor skill.
Right.
It is not a permanent physiological change to your muscle mass. You are consciously deciding to close the system before the pressure hits.
Exactly.
And here's where it gets really interesting. Because when you read through the protocols in these sources, they draw a very sharp, distinct line separating the knack from traditional Kegel exercises.
Oh, absolutely.
I think most people, myself included before reading this, just lump all pelvic floor exercises into the cable bucket. But they are fundamentally different tools working on completely different hardware.
They are completely different in both their real-world application and, their underlying physiological goals. To understand why, we have to look at the muscle fibers themselves.
Okay, let's get into it.
So a standard Kegel protocol might involve 3 sets of 8 to 12 maximal contractions. You hold each one for 6 to 10 seconds, you rest in between, and you do this 3 to 4 times a week.
I mean, that sounds like a standard weightlifting routine at the gym.
Because it essentially is.
Right.
The goal of a Kegel is to build muscle, hypertrophy, actual muscle thickness and endurance over a period of 8 to 12 weeks.
Right.
To do that, Kegels primarily target the slow-twitch muscle fibers. Those slow-twitch fibers make up about 70% of the pelvic floor. They are the marathon runners of your muscles. They don't react very fast, but they maintain your resting postural tone all day long without getting tired.
Okay, so Kegels are your long-term investment in structural support, but the knack is completely different because it targets the other 30%.
Right. The knack is purely a motor skill. It is an instantaneous habit that utilizes the fast-twitch muscle fibers. These are the sprinters of your muscular system.
Oh.
Yeah, they make up the remaining 30% of the pelvic floor.
Yeah.
And they're specifically designed to react incredibly quickly to sudden, forceful events. So you aren't doing the knack to build muscle mass over 12 weeks. You are doing it to deploy the muscle mass you already have at the exact millisecond you need it most.
It sounds exactly like the difference between lifting weights at the gym to get generally stronger, which is your Kegel, versus learning the exact physical technique to catch a fast-moving baseball, which is the knack.
That is a perfect analogy.
Right, because if you don't snap your glove shut at the precise moment the ball arrives, it simply doesn't matter if you can bench press 300 pounds. The ball is hitting you in the face.
Exactly. Having immense baseline strength doesn't matter if your urethral sphincter closes a second too late. The secret lies entirely in the timing, not the force.
So if they are contracting right before the cough, they must be creating a physical barricade before the pressure wave even arrives. Does the clinical data actually show that happening mechanically inside the body?
It absolutely does. The clinical guidelines dictate a very specific timing mechanic. The contraction must be initiated just before the physical stressor, ideally about 1 second prior.
Okay, 1 sec.
Right, and then crucially, it must be maintained during the entire event. So you hold that contraction while you cough or sneeze, and then you relax.
Yeah, I noticed the sources put a huge emphasis on that relaxation phase afterward. Why is that so important?
Well, because if you don't consciously relax the muscle after the stressor has passed, you risk the muscles becoming hypertonic.
Meaning they get stuck.
Yeah, they get overly tight or stuck in a clenched position, almost like a permanent Charlie horse in your pelvic floor.
Yeah.
That can lead to pelvic pain and actually make incontinence much worse because a permanently clenched muscle loses its range of motion. It literally can't contract any further when you actually need it to.
Okay, that totally makes sense. You have to reset the system. So we've got the timing down, 1 second before, hold through the cough, then release. But what's fascinating to me is what researchers actually saw when they looked at this happening inside the body.
Right. What's fascinating here is the ultrasound data. Researchers used dynamic perineal ultrasound, which is essentially taking a live, real-time video of the internal anatomy
Yeah.
while these women coughed.
Wow.
Yeah, and they specifically watched the bladder neck, which is the funnel-like opening where the bladder meets the urethra.
And what did that live video show?
Normally, when a woman with stress urinary incontinence coughs without doing the knack, the sudden pressure from above forces the bladder neck to descend anywhere from 5.4 millimeters to 8.1 millimeters.
Oh, so it really drops.
It gets physically shoved downward by the force of the cough, and that downward movement pulls the urethra open. But when they perform the knack, meaning contracting just 1 second before the cough, that downward descent was cut in half.
So by contracting early, you are literally pulling the structures up toward the head, which the papers call moving them cranially and building a physical shelf.
Exactly. The active contraction elevates the pelvic floor cranially and forward. It stiffens all the supportive connective tissues and acts like a rigid shelf, stabilizing the bladder neck so it can't get shoved downward by that pressure wave.
You know, going through the sources, the data on how well this anatomical shelf actually works in practice is phenomenal. I really want to highlight the results from a specific clinical evaluation they used called the paper towel standing stress test.
Yes, this is such an important test.
And to set the scene for you listening, this isn't some gentle, comfortable assessment. It is a highly rigorous stress test. They actually filled the participants' bladders with 250 cubic centimeters of fluid using a catheter.
Which is roughly a full cup of water placed directly into the bladder, so they are starting at a standardized, very significant volume.
Right, they are genuinely full. Then the women stand up, hold a standard brown paper towel against their perineum, and perform 3 hard, maximum effort coughs.
It sounds incredibly uncomfortable, but it is a very objective way to measure exact leakage volume. By using a standardized paper towel, researchers can measure the precise area of the moisture left behind. They literally measure the square centimeters of the wet spot to calculate the exact volume of the leak.
And the results were practically instantaneous. Like, they didn't send these women home for 12 weeks of rigorous strength training. They just instructed them on the spot to try timing a contraction with the cough. And the numbers speak for themselves.
Oh, they are staggering.
During moderate coughing, utilizing the knack reduced the leakage volume by 98.2%.
Just think about that. A near total elimination of the symptom instantly, just by changing the timing.
And even during deep, hard coughing, it still reduced leakage by 73.3%. Let's talk about what that looks like in terms of actual moisture on that paper towel.
To put it into perspective, in the non-pregnant women tested, the median wetted area on the paper towel without the knack was 43.2 square centimeters.
Okay.
When they utilized the knack, it dropped to just 6.9 square centimeters. That is the equivalent of going from a highly visible, significant leak of about 1.5 milliliters down to a mere 3 drops of water.
Going from an ounce of liquid to just 3 drops is a massive quality of life difference. And it was even more dramatic for the pregnant women in the study.
Oh, yeah.
Women at 35 weeks of gestation, meaning they have the full significant weight of a late-stage uterus resting directly on the bladder.
The home version of this test.
Their median leak went from 14.8 square centimeters without the knack to absolute 0 with the knack.
0 leakage. And that highlights something incredibly important about the physics here. Even with the added mass of a pregnancy pressing down, if you create that physical barricade and stiffen the urethra against the specific vector of force before the cough hits, you can entirely neutralize the leak.
Okay, so knowing this is possible is great, but it brings up a huge practical issue. Like, how do you actually acquire this neuromuscular coordination? You can't just walk around clenching your muscles 24/7 hoping you catch the sneeze in time.
No, you definitely shouldn't do that for the exact reasons we discussed earlier about hypertonic muscles. You will just exhaust your fast twitch fibers and end up in pain.
Right.
Acquiring this skill requires learning how to isolate the correct muscles and then integrating that conscious contraction into your daily reflexes until it becomes second nature.
The sources outline a few different clinical teaching methods. In a physical therapy setting, therapists use very specific verbal cues to help patients find the right muscles without accidentally tensing their abdominals or holding their breath, which I guess is a really common mistake.
Very common.
So, for practicing those fast twitch contractions, they use the analogy of a tap on off, like quickly turning a faucet on and off. And then for slow contractions, they tell patients to imagine an elevator going up and down slowly, floor by floor.
Those verbal cues are very helpful for mental visualization, but the literature clearly shows that tactile feedback is often the gold standard.
Right.
Vaginal palpation by a physical therapist allows the patient to feel exactly which internal muscles need to lift and squeeze. Studies show this hands-on physical feedback significantly improves the patient's maximum voluntary contraction compared to just hearing verbal instructions.
But if tactile feedback is the gold standard, that creates a huge accessibility problem, right? I mean, not everyone has the time, the money, or the geographic access to see a specialized pelvic floor physical therapist. So is there a way for someone to figure this out in their own living room?
Well, that is exactly what researchers wanted to know, and they ran a brilliant pilot study to test it. They wanted to see if women could learn the knack entirely on their own using a simple 15-minute automated video tutorial.
And what I loved about this study is that it wasn't just like a dry medical video of an anatomy chart. They relied heavily on social learning theory.
Exactly. Social learning theory dictates that we learn best by observing behaviors in contexts we recognize. So, the video used real-life vignettes showing women anticipating everyday bladder challenges.
Yeah, they showed a woman pulling her car into her driveway, feeling that sudden, desperate urge to go as she fumbled with her keys, and using the knack to calm the bladder reflex.
Right.
They showed a woman using it while getting out of a car or hearing running water in the kitchen, or briefly stepping in place while jogging to reset her pelvic floor.
Yeah, by showing these specific vignettes, they gave the viewers a practical mental model for the timing. They linked the physical motor skill to a real-world trigger. It wasn't just abstract anatomy. It was, when you hear the water run, do this.
And it worked. 1 month after watching this single 15-minute video, 71% of the women reported significant self-perceived improvement in their symptoms.
It's amazing.
They compared this to a control group that watched a generic video on diet and exercise, where only 25% felt any improvement.
It profoundly proves that for many women, the barrier isn't a lack of physical strength. They already have the muscle mass required to stop the leak. The barrier is simply a lack of knowledge about how and when to deploy the strength they already possess.
So what does this all mean for long-term health? Are we just putting a Band-Aid on a weak pelvic floor? Because if you get distracted or you get a sudden sneeze and you forget to do the knack, the automatic reflex is still broken, so you're still going to leak, right?
Well, if we connect this to the bigger picture of pelvic health, we have to look at how the knack fits into a comprehensive treatment plan. The knack is a brilliant tool for immediate symptom management, but we ultimately still want to improve the baseline health of that abdominal canister we talked about at the beginning.
Right, the core strength.
Exactly. To explore this, one of the papers compared the knack to a regimen of hypopressive exercises over a 5-week period.
Hypopressive exercises. That is a completely different approach from both Kegels and the knack, isn't it?
Very different. So hypopressive basically translates to low pressure. These exercises involve a series of specific dynamic postures combined with very targeted deep breathing techniques.
Okay.
You exhale completely, and then you perform a false inhale, meaning you expand your rib cage laterally without actually taking in any air.
Wait, so you expand your ribs while holding your breath. What does that do?
It essentially creates a vacuum effect inside the abdominal cavity. That vacuum physically pulls the diaphragm up, and reflexively, it pulls the pelvic floor upward along with it. You aren't consciously squeezing the pelvic floor at all. The pressure change in the canister does all the lifting for you.
That is fascinating. So the body's being trained to lift the pelvic floor through breathing and posture rather than a conscious muscle flex.
Yes, exactly.
And the study found that while both the knack and hypopressives reduce leaking, the hypopressive exercises actually outperformed the knack in long-term enhancement of overall muscle strength and endurance.
Exactly. Because hypopressives and Kegels are actively training the baseline tone of the muscles over weeks and months. So the takeaway for anyone listening is that you shouldn't view this as an either-or scenario. The knack is your immediate, real-time public health tool.
Right.
It is the emergency brake you can pull today to stay dry, go for a run, and instantly regain your confidence.
But therapies like hypopressive breathing and traditional Kegels are your long-term investments. They are the structural maintenance work you do behind the scenes to rebuild that automatic reflex, so eventually you don't even have to think about the emergency brake anymore.
Beautifully said. You need both the quick reflex and the long-term structural integrity.
I love that framing. And for you listening, this isn't just medical trivia to file away in the back of your mind. This is an empowering, zero-cost trick that you can literally start practicing right now. You don't need a gym membership, and you don't need equipment. You can sit right where you are, initiate a fake cough, and practice engaging those muscles just a split second before the pressure hits. You can master your own body mechanics to instantly regain control over a stressful situation.
And honestly, it leaves us with a fascinating concept to mull over as we wrap up today. We mentioned at the start that we often mistake timing issues for strength issues.
Right.
We'll have a profoundly frustrating physical problem like stress, urinary incontinence, can be almost entirely neutralized simply by fixing the timing of a muscle contraction. What other physical weaknesses in our daily lives are actually just timing errors?
Oh, wow. That is such a great point. It really makes you wonder about other chronic aches and pains.
Think about tweaking your lower back when lifting a box off the floor, or, the sudden joint stress you feel in your knees when running. How many of those injuries aren't about a lack of brute strength in your back or your legs?
Yeah.
How many of them are simply coordination errors? Your core bracing a second too late, just waiting to be corrected by a simple conscious habit.
It completely reframes how we look at our own physical limits. It turns out sometimes you don't need to be the weightlifter deadlifting 300 pounds. Sometimes you just need to know exactly when to close your glove to catch the baseball.